Welcome to Section 3 of Joint Health and Degenerative Disease. We'll be talking about how you can prevent osteoarthritis. In 10 minutes, you'll learn the breed predispositions for osteoarthritis, the connection between obesity and arthritis, and what supplements are available to help prevent arthritis. We often default to thinking about dogs when we talk about osteoarthritis, but there are certain breeds of cat that have a predisposition to osteoarthritis as well. Hip dysplasia, the abnormal development of the hip joints, is especially noted in the Maine Coon cat, but also in Persians, Siamese, and some other breeds. Patelloluxation, the dislocation of the kneecap, is more commonly noted in Abyssinian and Devon Rex cats. And Scottish folds, pictured here, are particularly prone to severe arthritis, affecting multiple joints due to a breed-associated cartilage abnormality that occurs. There are several breeds of dog who are at a higher risk for developing osteoarthritis. This risk may result from genetic-associated developmental joint disorders or simply due to size-associated joint wear and tear. The most common breeds we see that are predisposed to osteoarthritis are the Bulldog, the French Bulldog, Golden Retriever, Chow Chow, English Mastiff, Great Dane, German Shepherd, and Labrador Retriever. Obviously, we all want to do anything we can to help prevent osteoarthritis. Osteoarthritis is both painful and debilitating. Owners have a very important role to play in their pet's joint health. Each step an owner takes to keeping their pet in good body and muscle condition will have a long-term positive effect on their joint health. It all adds up. Just a few extra calories a day will lead to weight gain. This causes a long-term negative effect by putting more stress on their joints. There is a clear link between obesity and osteoarthritis. It is a cycle and potentially a vicious one. Obesity results in excessive forces on joints and articular cartilage. Repetitive excessive forces can cause joint damage and injury. Injury causes pain, which inevitably leads to inactivity and further weight gain. Thus, a vicious cycle ensues. Keeping dogs at a good body condition score will impact their health beyond the joints. Adipose tissue is really like having another organ. It is metabolically active and pro-inflammatory. So obesity may contribute to inflammation. Obesity-associated inflammation can make joint disease worse while contributing to other diseases in other organ systems, such as kidneys, skin, and pancreas. Take action in your obese patients. The negative effects of excess weight may be obvious in an obese dog, especially when obesity-related disease such as diabetes or skin disease are present. One should not overlook the long-term negative consequences in an overweight, but otherwise clinically healthy, dog. Obesity requires action even if those are baby steps. Baby steps add up. Calories matter. Have you ever wondered if lean dogs live longer? Well, guess what? We have the research to prove it. A long-term study of 48 dogs fed the same diet found that those fed 25% less quantity experienced longer delay to development of chronic disease, including osteoarthritis. These dogs weighed less, had better body condition scores, and lived an average of 1.8 years longer. Will exercise cause osteoarthritis? No. In fact, exercise is key to maintain a healthy body and muscle condition score. Healthy exercise will not cause osteoarthritis in normal joints. Bonus perk, exercise is good medicine for us humans too. Fact check, common sense, exercise is not harmful. Curious human sports medicine doctors decided to do a meta-analysis of the veterinary literature since dogs can be models for people. They reviewed as many qualified papers as possible on exercise and specifically knee joint health. They showed that moderate daily exercise was not detrimental to the knee joint. In further studies, 11 healthy beagles who exercised on a treadmill at 2 miles an hour for just over an hour, 5 days a week for 10 years, did not have evidence of cartilage disease in any joints. Antinol is a tool in osteoarthritis prevention. Key background research in rats investigated the ability of a range of supplements to prevent bacterial-induced arthritis. Ibuprofen, aspirin, and salmon oil failed to prevent arthritis. PCSO 524, the active ingredient in Antinol, effectively prevented arthritis development at a dose of 5 grams per rat. Antinol is a proven tool in osteoarthritis therapy. Antinol versus routine fish oil use went head-to-head in a blinded and randomized 24-week trial. Checkpoints were every 2 weeks. Endpoints of evaluation were a blood biomarker of osteoarthritis, lameness and weight-bearing scores, range of motion, along with specific gait analysis measurements called peak vertical force. Antinol was associated with statistically significant improved lameness and weight-bearing scores, improved range of motion, and positive gait analysis results. So Antinol is a proven tool in osteoarthritis therapy and prevention. In fact, improved parameters were noted in the Antinol group by 2 weeks. 12 weeks of fish oil was not associated with any statistically significant improved endpoints. Antinol was also associated with a decrease in blood levels of biomarker WF6. Lower levels of this particular cartilage biomarker demonstrate that Antinol may decrease the cartilage destruction in dogs with osteoarthritis. So you can help prevent osteoarthritis. Keep pets at a lean body condition score and a healthy muscle condition score. Monitor weight, muscle condition score, and body condition score frequently with the veterinary team. Use supplements that have clinical data showing efficacy, such as Antinol, and keep those pets active. Thank you for joining us. Next up in this series are the risks of pain medication.